Hi everyone, so I'm Darsh Patel Gupta. I'm an occupational therapist here at Soul Focus. Everyone's going to say, what's an occupational therapist? And as I go a little bit more into it, what's the difference between occupational therapy and physical therapy? So I just want to keep it very on the base, on the surface, and just let you know occupational therapies is all about what is important to you, what matters to you, what is interfering with what you do and is not getting you better that we help you with. And that's a difference between occupational and physical therapists. Physical therapists will say, what's the matter with you? We're more about a holistic approach which assesses the patient in terms of what's important to you, what matters to you. So that's a big difference between the OTs and PTs. Our goals are common, but we want to make sure that we get you better. That's the best goal that we want to work with you on. So where do we practice? We practice with children that are newborn right away in the hospital, in NICU, intensive care units, all the way to the continuum of care, which is I call the circle of life, to the end, to a geriatric population, to end stage for patients that are on hospice care. It's all about us making sure as occupational therapists that at the beginning of your life that you have the proper development skill sets, whether that's through play integration that you continue to develop as a child, or towards the end stage of life that you continue to practice your independence and regain the skills or maintain the skills where we teach you how to take care of yourself. Using different approaches, just as play with kids, using different functions in terms of what we've assessed as far as using different tools or modalities in a physical environment where we use ultrasound, STEMS unit. Our hands are our best tools as occupational therapists, where we take a holistic approach, and we may ask you questions initially to know the psychological side of you before we treat the physical side of you. So we deal with a lot of injuries depending on the setting where we work on. An occupational therapist works in a psychiatric setting, and they may just provide type of group setting where that patient resident feels comfortable in their self-esteem, kind of getting a routine going through their day, which is very different from the practice here in outpatient, where it's about physically, neuromuscularly, musculoskeletally. Hey, what's wrong with your form? Form follows function. We have to discuss your form, but we'll take a very integrative approach in dealing with what's the matter with you to provide you what matters to you. So that's your function. What matters to you is your function. So it's our job to assess you on a physical impairment level, and then give you the independence through regaining your skills to follow your function. That's occupational therapy in a nutshell for you. So today, one of the things I want to discuss with you is what I would see in an outpatient clinic as an occupational therapist, some of the diagnoses. And through this pandemic, we've kind of been in the house a lot. It's summer, we want to go out and play a lot. Some of the muscles could be rested, and they're just coming to a point where we're going to use them, and you're going to feel that achiness, that pain, all that symptoms. So repetitive stress injuries, as we try to enjoy playing golf, for example, playing tennis, things that are, that we will use with our hands. Those are the type of injuries I want to discuss with. Shoulder, elbow, hands, you're going to kind of feel that. Two of the diagnoses that we see commonly in an outpatient clinic that an occupational therapist will work on for repetitive stress injuries are medial epicondylitis and lateral epicondylitis. This is called a golfer's elbow in terms of how straight you keep your arm to take that swing through, or as a tennis player, you may see a lot of lateral epicondylitis, thus the name tennis elbow, which involves a lot of rotation. So some of the symptoms you may experience are pain, swelling, a lot of tenderness. If you're shaking someone's hand as a tennis player, you may notice difficulty in your grip. What's happening is those muscles that come off your epicondyle of your arm bone, they're being pulled. A lot of resistance stress is being pulled on them. So what happens? That's trauma, micro trauma to your arm. So swelling is going to start. Once that localized swelling starts, it restricts your movement. What's important to you? What matters to you as a patient? Your independence of being able to play golf, being able to play tennis, shake someone's hand is being taken away from you, where it's limiting your social skills, your social activities. So that's my goal, is to return you to your independence of having a social life, having an independent life, being able to be an active participant in the community. So what will I do when I first see you and assess you? I may use some tools to check your grip strength, see how your coordination is, how your wrist movement is, what triggers the pain, and how do we treat that. We may treat that through using ultrasound, using my hands. Your hands, again, are your best tool. Do some gentle stretching, get that swelling out of there. We may use other tools as stim, having you then go through gentle exercises not to aggravate that pain. It may take us 2 to 4 sessions before we may see a change. So in a nutshell, that's what repetitive stress injuries are dealt with on an outpatient clinic, and what an occupational therapist will do for treatment for them.